When we think of psychotherapy, we always have to remember that there are various types of psychotherapy. So one of the ones that we always try to think of is psychoanalysis. And basically the goal of psychoanalysis is a resolution of your neuroses. Get rid of those little quirks that drive everybody crazy. The goal of insight-oriented psychotherapy is to mostly focus on your interpersonal goals. Find out people who have personality disorders. Why do you always marry the same type of person? Why do you always do the same types of things? Why do you always make the same mistakes? And that's what you hope to accomplish when you have insight-oriented psychotherapy. Supportive psychotherapy is more of an ego builder. What you're trying to do is, for patients that are very sick, try to provide reality testing and to make them feel safe in an environment where they can tell you anything that they want. Behavioral psychotherapy is basically focusing on trying to change things that you have been doing, which are technically considered wrong for most of your life. So you are trying to unlearn many things. And so what you're trying to do is to modify all those behavior patterns that you've had, which you technically had learned. Group psychotherapy is also for alleviation of symptoms. And of course, you can see it in homogeneous groups where everyone in the group is the same, heterogeneous groups where then the groups are different. And the focus, or the goal I should say, of cognitive therapy is to change your distorted views about the world, to change your distorted views about yourself. There are numerous people out there who have depression, and the reason for their depression is because they have these negative distortions, and that's where cognitive therapy is going to be very effective. When you have patients who are in psychoanalysis, you have to be very select in who you allow to have psychoanalysis. So it's usually only used for people who are psychologically minded, only used for people who are relatively healthy and can tolerate the extent of the type of psychoanalysis. Insight-oriented psychotherapy, the first thing you must assume, of course, is that you have intact reality testing. If you are schizophrenic and believe that you are a Martian, I don't understand how much insight you're going to gain because you are clearly psychotic. So first of all, remember, you have to have intact reality testing and have capacity to have insight. You must be able to have the understanding that you can understand what is going on with you. Supportive psychotherapy is basically given to healthy patients in times of crises. For example, people that are in grief, people that have adjustment disorders. It's also used for those that are very sick, such as the schizophrenics. Behavioral psychotherapy is basically used when individuals have maladaptive behaviors or psychophysiological disorders. For example, patients who have anxiety disorders, patients who have phobias, patients who have eating disorders where they have learned certain things, and what you're trying to do is help them unlearn these behaviors. Group therapy, of course, depends on who it is you're trying to target as far as who will be in your group, whether it's the same type of people, heterogeneous, where it's different types of people or different diagnoses, family-oriented psychotherapy, etc. And cognitive therapy is usually used for people who have depression. Psychoanalysis is very lengthy, so you're going to be meeting with your therapist every day, approximately 4 to 5 times a week, for many, many years. So you can imagine you have to have the time for psychoanalysis, and not only do you have to have the time, but because most insurances will not pay for this, you probably need a lot of money. Insight-oriented doesn't meet as often because all you're trying to do is gain some insight from this type of therapy. So you probably meet with your therapist 1, 2, 3 times a week, probably for months to maybe years. But it's not as extensive as psychoanalysis. Supportive psychotherapy, because it's mostly given for people who are either grieving or have an adjustment disorder, you know that it tends to be more limited. So you probably meet for days to even months, and in some situations, for example, if you're schizophrenic, you'll probably be going to your therapist for years. Behavioral psychotherapy tends to be time-oriented, time-limited, whether it's weeks or months, and you're only going to focus on changing that maladaptive pattern of behavior. Group psychotherapy will generally meet once a week, and again for months to years, depending on the type of group. And cognitive is the one that is usually very time-driven. So you will meet approximately once a week, probably for anywhere from 15 to 25 weeks. Now, the techniques that are used in these types of therapies are very different. In psychoanalysis, that's the classic type of therapy that you see everywhere on TV and cartoons, etc. That's where you have someone lying on a couch, the therapist sitting behind that individual, and the purpose of this is that it allows the patient to basically freely talk about whatever they want to. They don't see the look on the therapist's face. They don't read the therapist's body language whenever you're talking to him or her. And that's a concept called free association. You also work on defense analysis, what defense mechanisms you use and how to basically change these defense mechanisms. Some patients are using maladaptive ones and you're trying to use adaptive ones instead. And of course, you also hope that your patient will gain transference or form transference with you, and that's what you're going to try to interpret, because how they treat you is probably how they treat everyone else. Insight-oriented, you're also going to deal with defense analysis and issues of transference. Supportive psychotherapy, since you're dealing with those that are not very sick or actually those that are extremely sick, you know that it's mostly problem solving or suggestion or just reinforcement, making sure that these patients take their medications on a regular basis. Behavioral psychotherapy will also use numerous techniques such as systematic desensitization, relaxation techniques such as deep breathing exercises, systematic desensitization, flooding, as well as the token economy system. Group psychotherapy, of course, will be based on the specific group, and that's the techniques that you will use. And cognitive therapy will basically use assigned readings. So what you have to do is that you have to start journaling, and when you have these negative thoughts, you have to write them down and replace them with alternate thoughts. So you will be meeting with your therapist, you will be discussing your homework, and of course, you will discuss all of these irrational beliefs or attitudes that you have been having. And what your therapist hopes is that you will change the irrational beliefs into rational beliefs.